Founded in 2006 as one component of Discovery's limited Black Economic Empowerment Exchange, the Discovery Foundation, a free trust, meant to put 150 million rands in awards that were equipped towards the schooling and preparing of 300 medical services experts over a time of 10 years. The 2020-21 alumni were awarded at the posh Maslow Hotel in Sandton, and what a stellar night it was. COVID-19 interrupted the plans, so the recipient had a young reunion after 2 years. The total value of the awards has been 280 million rands in urban areas and 65 million in rural areas. Dr. Mapai, founder of the Discovery Foundation, said the money is incredibly well spent as it contributes to the healthcare of South Africa. Dr. Mapai went on to further say, "It's been an exciting but humbling experience. When we started, we could hardly get applications, but through perseverance, we now have more applications that we can afford."
Well, really it has been a very exciting but also a very humbling experience. When we started, we could hardly get applications from our target group enough to appoint, so we always were running short of applicants. And of course we were targeting particularly blacks and women, but we also included whites. But particularly amongst blacks and women, it was a rough ride from the beginning. But we stayed on, and we are so proud that now we have more applications than we can afford. And most importantly, the work that our alumni is doing and the leadership that they are occupying is very, very exciting, very humbling. And it does show that it's important in life to stop complaining and see what role you can play and play that role, and it will send a tiny ripple of hope, but hope it will send, and we think this is what we are doing now.
I think it's so important that our youth from their communities have the opportunity to study further and to become doctors, so that they can serve the communities where they come from. I find that so many of the medical students who come from rural areas have experienced the lack of healthcare in the communities and in their families where they come from. And that motivates them to go back to study medicine and go back to serve their communities. My connection with the Eastern Cape comes a long way, because I started as a junior doctor working in the then old Transkei and then the Ciskei. So I spent a considerable time of my career in the Eastern Cape, and I've experienced the challenges that the rural people have in accessing healthcare because of the long distances they have to travel, the expense of traveling, the roads that are not good. So I think it's really important that we train our medical students to be familiar with those situations. So where I'm involved with, the students actually go to rural district hospitals for part of their training. So I spend time with them at those hospitals, and we see patients at the hospital, but we also go out to clinics and see patients in the clinics where it's nearer to their homes.
So the South African Breast Milk Reserve is an organization that's been around since 2003, and the work that we do is that we supply donated breast milk to premature infants, and this is life-saving. And with the support of the Discovery Awards, we've been able to sustain our programs and expand them, especially during the COVID-19 pandemic, where there's been a threat to breastfeeding. So with the Breastfeeding Week that's coming up, breastfeeding, South Africa has some of the lowest breastfeeding rates in the world, and premature infants cannot latch onto their mothers, and donated breast milk is life-saving for young infants. So the SABR, our work is across most provinces in South Africa. We work both in rural and urban areas, and our reach has expanded. We have a good database of women who are donating breast milk. So we're just excited that we've been able to sustain the work that we've done and also expand it during COVID in the last 2 years, and we're looking forward to expand it more.
In terms of the initiatives that I've been involved in, there's quite a number of them. I'm going to start off with the one that Discovery has funded, which is the reason why we are here today. And that one had to do with the Initiate Mental Health, mostly in the Eastern Cape. And what that means is that if we look at the mortality and morbidity that is associated with the rite of circumcision, traditionally, there are very high morbidity and mortality rates. And how I got involved is we got requested to provide intervention for a group of young men who were unfortunately exposed to botched circumcisions. So as a result of that, their mental health was affected, and because I'm a mental health practitioner, we were then asked to plan an intervention, which is how Discovery got involved, because after that initial intervention, I then submitted an application to say there's more we can do. We should actually be training whoever is able to have access to these young men to be able to tell when there are mental health issues. And then the other initiative that I also got involved in was something that we started during COVID-19, because we were fully aware of the huge burden of mental disorders and mental distress that was affecting healthcare workers. So as a result, what we then did there was to do an intervention that is focused on supporting healthcare workers during COVID. In addition to that, I also encourage a lot of suicide awareness campaigns, specifically to do with informing the general public what mental disorders are, how they affect one, how they present, but more importantly, what one can do to try and help yourself by strengthening your coping skills. And those initiatives are specifically focused on saying, in order for us to remain healthy, we should actually be proactive. We should be looking at how we manage our stress, how we manage with daily problems to make sure that we do not go on to suffer from mental illness.
I've always liked pediatrics, just general peds, and I thought about which subspecialty still incorporates general peds and almost like puts it at a depth. And so nephrology came to my heart and to my mind, and I fell in love with it. And so even from registration time, I just saw how much dedication it takes to actually be a subspecialist in nephrology. And so yeah, I fell in love with the discipline.
For Social TV from the Discovery Foundation Awards, I am Noktula Kwela.
For more stories like these, go to www.social-tv.co.za. Subscribe to us on YouTube and follow us on our social mediums.